Good day all. I am Dr. G. Durga Devi, Professor and Head of Anatomy, Sree Balaji Medical College and Hospital, Krompet, Chennai. Today we will be discussing about axillary artery. The competency for this topic is AN 10.2. The objective is, by the end of the session, the student should be able to describe the origin, the cause, the parts, relations, branches of axillary artery. Now let us see the origin of axillary artery. Axillary artery is the artery of the upper limb and is the continuation of the subclavian artery. It extends from the outer border of first rib as the continuation of third part of the subclavian artery and ends at the lower border of teres major muscle, from where it continues as the brachial artery. The artery is divided into three parts by the pectoralis minor muscle. The first part extends from the outer border of the first rib to the upper margin of the pectoralis minor as shown in the diagram. And the second part is the part behind the pectoralis minor muscle, and the third part extends from the lower border of the pectoralis minor to the lower margin of the teres major. Now coming to the relations of the artery. As shown in the schematic diagram, the relations are divided as according to the parts. The first part of the axillary artery, the anterior relation includes, it is consisting of skin, superficial fascia, clavicular head of the pectoralis major muscle, and the communicating loop between the medial and the lateral pectoral nerve. Posterior relation of the first part includes the first two digitations of the serratus anterior muscle, the medial cord of the brachial plexus, long thoracic nerve of Bell or the nerve to serratus anterior. Medially, it is related to the axillary vein and laterally to the lateral and posterior cord of the brachial plexus. Now let us see the relations of the second part of the axillary artery. The anterior relation to the second part include pectoralis major muscle and pectoralis minor muscle. Posteriorly, it is related to the posterior cord of brachial plexus and the subscapularis muscle. Medially, it is related to the medial cord of the brachial plexus and axillary vein. Laterally, it is related to the lateral cord of the brachial plexus. Now coming to the third part of the axillary artery, the anterior relation to the third part, the structure related is medial root of median nerve. Posterior relation to the third part include axillary nerve, radial nerve, subscapularis muscle and teres major muscle. Medially, it is related to the medial cutaneous nerve of forearm, medial cutaneous nerve of arm, ulnar nerve and the axillary vein. Laterally, it is related to the muscular cutaneous nerve. To all the three parts, the axillary vein remains medial to the axillary artery. Now let us see about the branches of the axillary artery. From the first part, one branch is given, that is the superior thoracic artery. From the second part, two branches are given, thoracoacromial artery or the acromothoracic artery. and lateral thoracic artery. From the third part, anterior circumflex humeral artery, posterior circumflex humeral artery, and the subscapular artery. Now let us see the branches of the axillary artery. From the first part, it gives off one branch, the superior thoracic artery. From the second part, two branches are given, thoracoacromial artery and lateral thoracic artery. From the third part, three branches are given, subscapular artery, anterior circumflex humeral artery and posterior circumflex artery. To remember the branches of the axillary artery, we can keep in mind the mnemonic. The mnemonic is, sometimes life seems a pain. Coming to the applied aspects or clinical aspects of axillary artery, palpation of axillary artery. The third part of the axillary artery can be palpated just above the lower border of the posterior fold of axilla formed by the teres major muscle. Compression of axillary artery in case of bleeding from the axillary artery. Pressure can be applied by compressing it against the humerus. Rupture of the axillary artery during reduction of shoulder dislocation. This will occur especially if the artery is adherent to the articular capsule. To summarize on the topic axillary artery is a continuation of subclavian artery. It continues from the lower border of teres major muscle as brachial artery. It is divided into three parts by the pectoralis minor muscle. The branches of the artery include, the first part gives off one branch, superior thoracic artery. The second part gives off two branches, thoracoacromial artery and lateral thoracic artery. And the third part gives three branches, the subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. Few applied aspects of the axillary artery include, compression of the artery in case of profuse bleeding can be done by compressing it against the humerus muscle in the axilla, or rupture of axillary artery occurs during dislocation of the shoulder joint, especially when the artery is close relation with the capsule of the shoulder joint. Thank you.